Are you starting to get unsteady on your feet, maybe a little wobbly with turning stairs or walking on uneven ground?
Well, you're in luck. That's exactly what physical therapists are here for, to determine, are you safe with walking at home, going up and down stairs? And there's a test that can give you a very good idea how safe you will be.
So that's what we're going to go over in this video.
Bob and Brad, the two most famous physical therapists on the internet.
Welcome to the Bob and Brad channel. We are the most famous physical therapy team on the internet.
That's right. And it's, of course, in our opinion.
So our goal of this channel is to help you stay healthy, fit, and pain-free.
Right. So this video is that part of being pain-free, fit, as well as healthy, keeping you upright, not falling down, how to avoid it.
So the test we're going to talk about today is called the Dynamic Gait Index, also known as the DGI. It has been around since 1995, and it was created by Shumway, Cook, and Woolacott. I don't know where those people are from, but they have very interesting names.
Well, we give them credit for coming up with a test like this. The big advantage of this test, it doesn't give technical information of how good your balance is. It gives functional information of the risk you are for falls at home, everyday situations, up and down steps, stepping over a small object like you would in your living room. That's what it gets into.
Also turning around and other activities. So there's 8 different tasks total on this. The test does not take very long. You can do it yourself. We'll link a printout down below. Just make sure if you feel unsteady on your feet, maybe have someone with you. They could possibly put a gait belt on you. If you have poor balance, you already know what a gait belt is. Otherwise, you can go to a therapy clinic and they can do this test for you. Also, you want to use an assisted device if you already use one for this test. Do not try to go without it.
You mean like a cane or a walker?
Yes.
So they can use it do this test as well if they do need a walker?
Yeah, you can, but you will notice if you print out the sheet at home, it does subtract some points if you use an assistive device, cane or walker, so just be aware of that.
Yeah, don't worry about it. Just go as you feel safe. Again, do this with someone to help you out, I recommend, or just go to a clinic. Then you know what's going on when you get there when they do the test. A
couple of things you may need before doing this test is you need about 20 feet or 6 meters of room to walk with. You will need a stopwatch, and you'll need something to work as a marker or obstacle to step around or over. That can be cones. We have toilet paper here, as you'll see later we're using. Also, something just to step over. It can be something as simple as a shoebox and a set of stairs. And make sure you are wearing your normal, comfortable clothes and have shoes on as well.
Oh, there you go.
So this test has 8 components to it, like I talked about earlier. Each component is worth up to 3 points, so the test is based out of 24 total points. We will tell you what your results mean later. Again, to follow the actual printout, it gets much more in detail and in depth of it, but Brad and I will just demonstrate it real quick how this test actually works. So Brad is going to be the subject. He's wearing his shoes. He doesn't walk with a walker. Is that what you normally wear at home? I don't know.
Yes, this is my normal attire. I wear this 7 days a week.
That's good to know. You even shower in it?
Mm-hmm.
Okay, the first one is just walking on a level surface for 20 feet at your normal walking speed. So we're going to pretend this is 20 feet, and Brad is just going to walk, and he's going to stop and turn. Well, you would just walk straight 20 feet, but we don't have 20 feet, so just walk back at your normal pace. And then you can read through the selection of how good or poorly they walked and just select the box there for your score on that one. Number 2.
And this is one thing that kind of takes practice or a therapist, a trained eye to see what gait qualities they have. So, it may be hard for the layperson to give a good, accurate score.
Yes, you can watch some other videos on this possibly, or have someone else assess you because they'll probably be a little more honest than you are on yourself.
Right. For example, that was a normal gait. If I want to show you a gait with perhaps a flaw, so this is foot drop. I'm unable to dorsiflex my right foot, and that's a common problem that some people have after a stroke or a neurological
Or they may
issue.
sway really far off to the side, have some type of deviation, or even lose their balance.
Yeah.
So those are some deviations. The next thing is walk again, but you're going to change your speed. So you're going to walk about 5 feet normal speed, 5 feet at a slower speed, 5 feet at a faster speed, and then normal again. And they just want to see if these transitions are fluid. So do you just want to walk normal?
Sure. So if someone has a normal
Okay,
gait.
now walk real slow. Now you would do this in one long line, so obviously it's a little hard in our small space here. And then you would have them transition to walking fast, all in one fluid motion. So we want to walk fast. Yeah.
And going slower, you might find a lot of people when they're walking slower, they become unsteady because that's just the nature of walking slow. When you speed up to your natural speed, you're more comfortable, you walk better. And sometimes fast, people get, it's one of those things you don't want to do is go walking fast because you're in a hurry, putting that person at risk. So they're all variables.
The next one is to walk and work on head turns. So we are going to do horizontal head turns first. So that is like you are saying no. So instead of constantly going side to side, the person giving you the test would say, can you walk in a normal line for me?
And I would recommend standing still, turn your head side to side. If you get dizzy standing still, turning your head, then don't do this test. It would be unsafe.
So walk normally,
Normal.
turn your head to the right, and then left. Now, the person giving you the test would tell you when to do it, so they may have you hold it for 5 seconds even while you're going one way, so it's kind of up to them how long you have to hold it each way. So it's not just constantly going side to side. You may go one side, then you may be center, then you may go left side. Basically, just seeing if you maintain your balance well.
Right. If you happen to have vertigo, that could set off a real unbalanced, particularly, it would probably standing too.
Now, the next one is a very similar concept, except for you're going to be going up and down. So you're going to be nodding yes. So you'll walk straight, look up towards the ceiling, and then the person will tell you when to look down and when to go back to normal.
Right. So I'm going to do it standing still. Feels good. Walking. Take your time with it. See how it feels. If you feel unsteady a little bit, just stop.
Walking backwards was not in this test. Brad is just showing off right now.
Okay.
Anyway, it's in a different test. The next one we're going to talk about is actually walking and then turning and how fast it takes them to turn and pivot around. Again, we would have shown this normally in one 20-foot clear walkway, but because of limited space, Brad is turning around. So this part of the test, you would actually turn around. So Brad, just walk, and then once you get to the stairs, turn around as quick and safely as you can. Good. And basically, we're just looking at how quick he is with it or how slow. We want to make sure you keep your balance. Don't force yourself to go fast and fall over. And also, we just want to see, make sure they don't lose their balance any which direction or if they're slower. So that's how that point is graded. Now, the next one is actually stepping over an object. They recommend just something like a shoebox, something with a little bit of width and height. Just place it on the floor. And what you're going to have the person do is they're going to walk and step over the object. Things the person is looking for is when they are walking normal, do they maintain their speed while stepping over, or do they really slow down, or do they lose their balance? So those are all factors that play into this point. So Brad would really basically stopped and then lost his balance, kind of fell forward. He did go over the object, but he would obviously lose quite a few points there, where that's more of a nice normal walking pattern. The next one, which is number 7, is stepping around an object. So you're kind of weaving in a way. This is the one where they recommend cones, just something small that you can go around. We just have toilet paper. You can use toilet paper. You want to place them about 6 feet apart. We don't quite have 6 feet of room in here, but basically they just want to make sure you can turn around the object going one way and turn around the object going the other way.
So it's a figure 8, basically?
Yeah, you can do it in figure 8, and then so Brad is turning
to the right.
Turning to the right, and then he's going to be working on turning to the left. If you only have one object, you can just go turn around one way and then go turn around the other way. But basically how you navigate going around an object.
Right.
Pretty good. Just don't step on the toilet paper.
Right. Well, that's a nice thing. It's light, it should be something that's safe that way.
And the last thing is doing steps. So just doing some stairs, whatever stairs you have at your house. It doesn't recommend how many exactly to do. We just have 3 here, so you'd go up and down how you normally would and feel safe. Just keep in mind, reading through the test, there's a big difference between how you do the stairs. Brad right now is doing 1 step at a time using 2 rails, so he would automatically lose points if you look at the test sheet. If he were to walk up no rails, alternating steps, very safe and controlled, he would get the highest points possible.
But when you do this, don't try to get the highest points possible. Do it the way you feel comfortable and safe. That's the way the test is meant to be done.
So when you do this, make sure you check or circle the numbers, whatever. All the tests look a little different. They're all the same thing. Make sure you get your score, and this will be your first score. Look at the parts where you struggle and work on those. You may need someone with you to work on them if you feel unsafe. Otherwise, definitely use your assisted device, meaning a walker or cane or railing as needed. You can practice them at a countertop for extra support if you feel unsteady. But those are the things you should really work on. If you're really already good at something, you don't really have to focus on that. Just focus on the things you struggle with. Now, when it comes to the scores, obviously a 24 would be a perfect score. That is very good. For people that are community dwellers or people that go out and about, you typically want to score between at least 19 and 24 to make sure you are safe and at a lower fall risk.
There you go. So it's gives you a good baseline. You may not have any problems, and this could be a good thing to do just to see where you're at. And maybe a year from now, and that's what therapists do, they need some objective history. Check it again in 6 weeks or 2 months and see how things have improved or declined depending on the situation.
Now, no matter where you're at, just a 2 to 3 point difference going up or down is quite significant. So make sure to keep working at it. And if you have maybe a 16 early on and then you get a 19 later, that's quite an improvement, and that's good. So keep working on it. Do not let things regress or get worse. Again, this is more for people that are out and about, more active. It's not for your average nursing home person. There are different type of tests for lower functioning people that therapists give, but this is just a generalized good one.
There you go.
The dynamic gait index.
All right. Good. I hope we've learned something, or they've learned something. We both kind of did too, I guess.
Well, I already do some of this because I do it with patients, but
yeah, it is a good test. But again, any question on it, I would seek professional help, go to a therapist, and they have the history and the background to make sure it's done properly.
Now, if you want to check out more videos on how to actually improve your balance, you can click the video link on the screen.
There you go. Oh, top balance exercises for seniors 70 plus. It'll work well for people if you're under 70 also.
For anyone that works on their balance.
Mm-hmm.
Bob and Brad, the 2 most famous physical therapists on the internet.